I'm Dr. Stefano Battista, MD, Emergency Surgeon Specialist. I am studying and practicing regenerative medicine internationally from 15 years. This presentation will focus on the application of regenerative medicine against COVID-19 SARS-2 related syndrome and its immunodysregulation damages. The microtechnologies so far are becoming ultra-micro every 4 or 5 years or so, and a few years ago we assisted to the advent of the nanodimensionality. The nanodimension of the matter is used for a multitude of goals in the vast area of the industry. This has opened a wide variety of possibilities in the biotech and in pharmatech areas that just 20 years ago were simply fascinating ideas or something preconceived, waiting to be started maybe one day, hopefully a day soon. The most of our advancements in the last decade in the field of therapies for the worst diseases to be cured is leading us clearly on the way of a more precision possible attitude. We are now going straight towards what we may define the personalization. A personalization of the diagnosis and of the entire medical strategy for optimizing the cures. Regenerative medicine has become stronger right in this era of sophisticated biotech, enlightened by the courage of scientists and clinics that used to work at the first beginning in spontaneous groups or proceeding their initiatives in small hidden network teams, sometimes forced to travel overseas. In the current time, a so vast attention by the health entities is very related to the new hopes suggested by the regenerative medical power, evocated on the animal organisms that showed a series of incredible results. So good results that really 20 years ago we couldn't expect studying the behavior of living tissues, etc. Always keeping up our guard against possible impostors and attempts to fraud. We are now living a time that can carry out the complexity of the sciences involved, and can also count on a deeper communication modality, giving light to a larger sharing audience of customers, whether people or institutions. And no matter if they come from different public sectors of interest or from private initiatives, such corporations, foundations, associations, etc. Today, it seems just like everybody's looking for a spot where to put their flag on the healthcare planet, to rule innovation and to gather the old wisdom. And new goals for foreigners' affairs are coming from the diplomatic level too. They show signals of already improvements for economic and humanitarian cooperation between countries, establishing liaisons helpful to international resolutions and relevant negotiations. The healthcare world is taking its supremacy for the wealthier societies as much for the richless ones on the planet. And the production of items ensuring protections for health is really representing nowadays a very promising investment for anybody. The healthcare world may surely enlarging its impact on the stock markets and play a role in the politics of multinational entities working for peace. But last terrible COVID-19 SARS-2 related pandemic news showed to everybody the rough side of the desperation. The massive attack coming by a mysterious agent gave a hard strike to our normal daily life. The consequences were soon tragic in a so unexpected, insidious way. we created a group, an international group, the G.A.T.E.CoViD19, Global Advanced Therapies for Emergency COVID-19, which some of the members are here today, and we collaborated to go deeper in this clinical and scientific vision. A vision which evidently goes from infectivology to immunology, from internal medicine to the resuscitation techniques and the emergency surgery, from ICU management to the provision of non-hospitalization measures, trying to offer a kind of treatment that could be useful. We shared a website that you see to synthesize our clinical contribute, and we tried to make it internationally, to put on the table a very professional point of view with real information coming from the experience on the field and directly from facing the ongoing viral pathology, featuring the aspects of the infection from the patient's assistance. This was made to better understand the whole phenomenon, saving the medical care knowledge and our primary attitude from the mainstream information not very reliable and homogeneous. And looking back at the beginning of the 2020 to the COVID-19 SARS-2 pandemy's birth, all we doctors and health professionals were so surprised but at the same time so cautious because of the uncertainty that was coming up from the general and professional news. For sure, we felt the fear coming from those videos showing the chaos and those images of the many sick people in the Far East with persons falling down on the street in the daytime. But at the same time, those scenes were just a continuous stimulation to try a fast and safe way out. And in few weeks, time by time, the threat became closer to every country, which at the beginning didn't think to be necessarily so involved by. And when the crisis comes over and the emergency grows, the ones that are ready first are surely those that are already open for innovation, and that are trained to see the solution behind the problem, which in this case was hardly complex, and it was requiring a very high level of responsibility for those in charge to managing the action. The innovation in medicine, particularly the one driven by the regenerative medicine, with the entire biomedical complex of concepts pointed towards the progressive application, moved my attention, pushing me to bring out something valid, able to fill the gap and make the difference. Thus, after a few weeks from the outbreak of the epidemic pandemic, was tremendously clear that we didn't have a solid cure or proper dedicated medications therapy to be used to really stop the disease. Just nothing to fighting against those huge and tremendous level of lethal complications that appeared just unstoppable. In that time, you, as an healthcare professional and as a clinician, try to understand what could be done soon and where can be a way to give help and reduce the risks. Regenerative medicine appeared to me as the source of a strong and an effective response, just looking at the cellular therapies and to the riskless biotherapies using autologous or allologous factors. I shared these notions with all my valid colleagues, with which ones were easy on the same page, trying to figure out what to do and what to expect for later. We thought about a range of treatments applicable from the preventative strategy to mild symptomatic stages until those ones against the terminal phase of the syndrome, a range of minimal traumatic applications. All of the members together sharing the same therapeutic concept connected with the regenerative medicine and its clinical results, made up their minds, moving right from the immuno-empowerment effects coming from the application, that generally are always a clear evidence of the good activation of the immunoregulation of the regenerative stimulation. When microorganisms attacking us and penetrate inside our dark environment, they survive and proliferate thanks to their ability to attract the dendritic cell's ability to interface and capturing by external. But we know them from a very long time. Microorganisms can mimic the antigen or being the antigens and carrying with them modulators of our internal energies and trying to use our systemic biosignals inside our cellular DNA's activities. The result is the onset of the reactive phagocytic cascade. The COVID-19, being composed by a type of carrier very well known by our immune system, is capable to get deep into the layers of the body, not provoking the activation of the barrier wall complex by the first-line responder. So once the body recognizes the sequences exposing the not-self antigens, he is already penetrated into the cellular environment, and his traces are just the deviation of his synthetic RNA transcriptions. So the immunosurveillance was strict, and the immune system at this point moves strongly against this abnormal, huge expression of extraneous proteic complexes that doesn't belong to our body identity. And that's the reason why the immunosurveillance has to be always supported. And checked it out by our medical activity on the patient, on a primary standard of care. Our nucleic acids are just weakened by the continuous bad stimulations driven by factors that are just not well tolerated by our innate regeneration way, and so this resulting as a toxic for it. This is what we may define as immunostage, coming out from the actual balance of the individual respective to his vital functionality level. The diffusion of the infection following the overall lymphatic system, and it goes in all the body and involves damages at the various progressive levels, from nervous system to the circulatory, affecting vascular integrity and hemorrhagic consequences, conducting to the hemorrhagic episodes or the coagulation cascade that are just next to the exitus stage. The cellular tissue therapies and its derivatives, extracted factors, give a strong signaling, evoking more active components of the cellular regeneration matrix, whereas autologous or not, and are able to stop in the firing reaction cascade, cytokine storming, immunocomplexes, procoagulative dynamics, multi-organ failure. This is the network theory by Niels Jern that showed very well the asset of our immune system and how it works to be in relation with the not-self world. The Nobel Prize Professor Jern described the complication of the immune system when it can be back to its native homeostasis. The many factors that can block the new balancing settings by the humoral and cellular response are all related to this network. And the entire process that recognizing the external extraneous entities as aptens or antigens, it is work as to find ideotypes to become model for the identification by a mirror picture of them that will bring our immune system to acquiring this type as a self and so storing in its memory. The result is an immune homeostasis dynamic level ideal for wellness. One more factor for our vulnerability, but in the other side, good for our strength, is the common legacy of the nucleic acids components that we are sharing with all the other living organisms on the globe. And this is always the main biological key to keep in mind for the clinical and therapeutic attitude on the human body. Today, we are facing the next COVID pandemic recurring to the method of an antiviral vaccination, with all the limits of the case that we well know. Regenerative therapies, as we know, are useful, particularly in conditions where the subversion of the homeostasis of the immune system is the main trigger event. And surely we saw in the SVF application and in the ones coming from the use of adipose-derived stem cells, a further weapon to be used to combat the pathological process and treat its progressive consequences, including the terminal phase. In the 17th century, Lin took care of scurvy epidemic using bionatural elements. Today, we know that the power of vitamins as antiseptical and reinvigorating factors for cell communication and functions is very helpful. But it's not a competition between synthetic drugs and biological ones. We all know that power of the first ones in the acute stage of a disease and the deleterious use in chronic affections, which are better treated with biological treatments. But we are far from to recurring as Mithridates, the kings of Pontus, that used to test the efficacy of his poison on the prisoner or slaves he had in his hands. The mesenchymal stem cells are a great point of care product too, and really deserve to be studied in clinical research while we can observe its very positive effects with no collateral ones. The internal balancing was the result of the ideal flowing of bioenergies, and in the old medicine, the right frequency was able to re-establish the wellness of the patient. That's what we see after a treatment with immunomodulators and antiphlogistic cytokines coming from the mesenchymal stem cells infusion, able to shutting down the turbulence of an ultra-level grade of phlogistic reaction in the organs congested by the chemotaxis and bad hypoxic metabolism. This is the cellular pathology that Rudolf Virchow from Germany taught us defining in his medical scholastic the famous triads. The same good effect to reach a fast recovery from COVID is the use of extracellular vesicles that can be a speedy factor able to shutting down the phlogocyst cascade and heating the cellular turbulences to an antiphlogistic complex using cytomediators to get back to the homeostasis of the immunity. And it's thanks to these two French pharmacologists and chemists, Pelletier and Caventou, then today we can discuss about the use of hydroxychloroquine. Therefore, there is now the exigence to design a new framework of healthcare, trying to move towards a more adherent model for individuals to be prevalent. On the side of doctors and other health professionals, and on the side of the national health system, I might say that both needs to be directed and to direct their strategies for more efficient clinical supervision through a larger measure of prevention and faster treatments, which is possible according to all the means currently available. And this can be done nowadays globally, having the easy access provided by the informatic digital technology and through innovative tools that can reveal a superior sensitivity and specificity. Finally, regenerative medicine is able to bring to patients a much more efficient focus to prevent the lack of vital body function against all the microorganisms that are living with us and before us on the planet. After this COVID-19 SARS-2 pandemic, we may say that regenerative therapies are now representing a clear step forward for consistent transformation to a higher hope level of recovery against this terrible infection, and more diseases still there weakening our vitality. This inexorable up level of frailties is now easy exposing everybody of us to lose our wellness, stopping us to enjoy life and shortening our possible lifespan. The empowerment of the organism can be reached very effectively through the biostimulation needed by cellular and its biocomponents extraction use, processed from the pristine tissues. So let's go for a better medical option for all the entire community now that we are still in time to avoiding what happened to the boiled frog, as is well described by its anecdotic metaphor. Thank you, everybody.